or the financial statements do not reflect the actual position of the institution. It means that it is bad. It means that there is a lot of mismanagement. So you've got two issues here to deal with. We can attempt to mitigate and try, and this is why I was seeking, and I'm going to request my colleagues that because of capacity issues, to allow the auditor and the governor to try and mitigate. However, it does not stop this committee from recommending for further investigation and possible prosecution, citing the law from ESCC and other investigating agencies. Because it's actually wrong. Every query we go through, we find that there are serious problem. You know, so I think you now need, as we are deliberating and will allow the chair to decide the way forward, you may really think about reconstituting your team.
Chair, because the senator came a bit late, I'd already said that the team you're seeing here is an entirely new team.
Okay.
Yeah.
The accountant who is trying very hard to answer some of these questions came in when the draft report was with the auditor and tried to do what he could in a very short period. So this is an entirely new team,
Okay,
a new
enough.
management, a new CEC. So
Fair enough. And
yeah, but I want to agree with you, Senator, absolutely, that there's need for us to sit down with the auditor to see how we can mitigate these things going forward, because even me, it concerns me that some of these things are the way they are. So we are more than willing to be to work closely with the Auditor General on these matters.
Just to conclude on my part, and then I give you say. Then I think in that case, Mr. Chairman, nothing stops this committee from recommending further investigation on those officers who were there. Yeah. Because I feel the accountant weight, because institutions are perpetual. So you carry out the sins of the other people. But at least the Constitution is very clear. If you read Article 226, subsection 5, it says that you are responsible for your errors, whether in office or out of office.
Yeah, I want us to make progress on this by this direction. Before you came, there was a revelation from the governor that the particular accountant who was involved in dealing with this matter has now been transferred to lesser functions, lesser duties. Now, clearly the law says, you have heard what the law says. I think we will ask that the investigation be done for those officers who are there, and this particular one, you take administrative action on this officer.
We are guided,
because
Chair.
these anomalies cannot be tolerated. You take administrative officer against that accountant.
I agree,
who
Chair.
now is doing lesser duties.
I agree, Chair.
Yeah. So let's move to unsupported balances.
Thank you, Chair. The statement of changes in net assets reflects capital fund balance of Kenya shillings 1,013,755,968, whose supporting records were not provided. In addition, the statement of cash flows reflects opening cash and cash equivalent of Kenya shillings 15,558,553, and an increase in capital fund of Kenya shillings 65,068 to 94, whose supporting records were not provided. In the circumstances, the accuracy and completeness of the capital fund balance of Kenya shillings 1,013,755,968 and the cash and cash equivalents balance of Kenya shillings 35,028,309 could not be confirmed. Thank you, Chair.
Governor, your response?
The capital fund balance of 1,013,755,968 represent deemed cost of assets belonging to Embu Level 5 Hospital, which had been identified at the time of the audit. Accrual basis of accounting under the IPSAS require that all the assets of the entity be identified and valued, which is IFRS 13 and fair value measurement. This process has been delayed due to budgetary constraints. Appendix 6A is a list of assets at Embu Level 5 Hospital identified as at June 30th, 2023. The opening cash and cash equivalent balance of 15,558,553 was not audited in the financial year 2021-2022. However, the balance is supported by bank reconciliation statement and bank statements. Appendix 6B, bank statements and bank reconciliation statements.
Auditor, your comments on the response?
Thank you, Chair. Apart from the cash and cash equivalent balance that we are able to confirm through the bank certificates, bank reconciliation and the cash book, the other balance cannot be confirmed as stated by the High Excellency. 1 billion.
Other balance for, because there are two aspects, the assets which in Appendix 6A, they are provided a list of assets, and then the bank statement confirming the 15 million.
The bank statement, that one we can confirm, but the assets.
So you can confirm 15 million?
Yes, Chair.
So what you can't confirm is the list of assets?
The list of assets, we can't confirm that.
Yeah, but
Chair,
just a moment. We had talked about the issue of assets earlier.
Yes, Chair.
Yeah, where the governor says they do not have a confirmed list of assets.
True, Chair.
Is that the position?
Yes, Chair.
Okay.
Chair, you know, Governor, can that guy sits down? You know, you had more time to explain to this governor when you had a meeting before here. So you sit there, unless you ask by the governor to respond. Governor, I want us to look at the question. Because if you see what I've done in my book, I've written wrong response. I want us to look at, I don't know why you guys complicate things. The auditor has said very clearly, the statement of changes in the assets reflects. Changes could mean positive or negative. Okay? Net asset reflect capital fund of 1 billion. Who's supporting? Now that is why I want you to highlight. Whose supporting records were not provided? So the first question to respond to, why were these supporting not provided? Then we go to the second part of the question. In addition, statement of cash flow reflect opening cash equivalent to 15,558,000. An increase in capital fund of 65,068,294. Whose supporting records were not provided? So before you even go back to say, oh, the capital fund of this represent, nobody has asked you what it represents. You've just been asked, why haven't you provided these documents for the auditors to go through? What happens, Governor, once you give us a response like this, you with identified assets. That's why the fund exists. And that is why the auditor is asking for the record for those assets. They can't be deemed. They are already identified. That is why it is existing. Because it's a net asset whereby all your liabilities are no longer here. Is that correct?
Chair.
Chair, yes.
Yeah. So there is a simple question of just providing the records of those capitals that have necessitated this fund. And in fact, you see it increasing with another 65 million. The 65 million will only increase if an asset has been identified, valuation done clearly on that asset, and you are very sure that probably even there are contracts towards purchase of that asset. That's when you replenish that fund. So I agree with this. Remember that this answer is completely confusing. Maybe you are confused.
Chair. Before you answer,
yes, I've not given you the chance.
Oh,
yeah, Senator Kisa.
good. You know, I've not spoken. I only introduced myself, Chair. You know, Chair, if you look at the Annex 6A, you know, they have listed all these assets, and I believe the list of these assets 6A, you should be having titles for the property. There is, what is interesting me is you even have an assorted ICT equipment of 6.6 million, assorted furniture 12 billion. You have a Nissan pickup, there must be a logbook. You know, these are things that are expected during the audit. You should have given them to the auditors so that they verify. You'll have the things that you bought, there must have been an invoice, there was payment voucher that was done, or RTGS. So basically, this is what the auditor is saying you did not provide. So, you know, instead of you deemed value, they are values. The ICU that maybe were done during COVID time. So, and there was money that was used to do these particular things. So I think, as you had, maybe you had said earlier that there was a capacity issue, but
Chair, may I ask the accountant to respond to that?
Accountant. And just note that from the explanation of Senator Ladama, the list of assets are not responding to the question. They are not responding to the query. Proceed.
Thank you, Chair, Your Excellency. What we are doing in our response is to list all the assets that amount to that amount of 1 billion. So, okay. Chair, what we are doing is to give a list of all the assets that amount to that amount of money, but I also want to state that these assets have not been valued, and that is why we are calling it a deemed cost, because some of these were acquired in 2013.
No one is asking you about the deemed cost.
Okay.
Let him finish. Proceed.
For instance, some equipment were acquired in 2013. Definitely they have depreciated in value. So until we do a comprehensive valuation of these assets, that's the only time we will be able to report this. Because this is the first time we are reporting on accrual for Level 5, and we have to come up with a fixed asset register.
Yeah, so can you comment on the figures here? The 65 million, the 15 million, and the 35 million.
15 million, I'll start with 15.558553. That was the opening bank balance, and the auditor has confirmed that we have provided the necessary document to support that. The query was, since we never had financial statements for 2021-22, how was it audited? And we have provided the supporting for that. 65 is 65 million is the growth as well captured, the increase in capital fund. I think,
Yeah, that one, because you have not provided records for the financial statements. An increase in capital fund of 65 million.
Chair, give me a minute. Financial statements.
Yeah, you. Auditor.
Yeah. Chair, as the accountant looks at his document, may I allow the Chief Officer Finance to say something? There's a clarification
Chief
we'd like
Officer,
to make.
from executive to Level 5. That's why they are defined as a capital fund. And also to end, we were able to provide, and we said this is the first financial statement we are doing for Level 5 hospital, and we had to do some separation from the executive books and creating the books, separating books of Level 5. That is why you can see we're able to raise, or rather to provide a list of all the assets at Level 5, and we assigned the value as per the project, the project value, or rather the money that was used to do that project. However, we are still to do what my accountant has said about valuation, so that we can also provide for the fair value after considering the depreciation. And that is where we are. Thank you.
Can you say
Chair,
something
Chair,
on
may I?
35 million? Just the 35 million. Cash and cash equivalent of 35 million, which is not supported here.
No, that one has been clear.
Just make a comment on that.
When we talk about cash and cash equivalent, we talk about cash in bank, and we also talk about the expected cash, maybe from debtors. It is treated as cash and cash equivalent.
Yeah, so the auditor is saying they were not, they could not be confirmed.
Chair, may I make a proposal?
Yes.
If the committee will allow that we sit down and provide proper records on this, because honestly speaking, that shouldn't have gotten here. It's something we should have provided during the audit. And as you've heard, the accountant came in after the draft had already been done, audit almost complete, and he tried to do what he could under the circumstances. But if you allow us and give us time, within the same time we have been given for the other matter, we could be able now to provide proper records of the assets of the hospital as at that date.
Chair.
I want to give Mark.
Okay.
Mark has been raising.
No problem, yeah. Then I'll come after.
Thank you, Chair. I think Her Excellency the Governor has alluded to what I was probably going to say, because, Chair, if you look at the documents that has been provided, the Annexure 6A, it has assets totaling to 934 million. I think the accountant has confirmed this was provided just to answer the query. The auditor has not verified this, the actual assets, their values. So I think, Chair, the auditor, I think, will have to relook this in the subsequent audit, because when this is provided here to answer to a query, then the accuracy of this cannot be confirmed. So it was just to respond to the query and not otherwise verified. Thank you, Chair.
Chair.
Yeah, just 1 minute, 1 minute. So we move to the next issues.
Chair.
We are repeating ourselves. No.
But Chair, we are here to be able to execute these matters, yes. What I'm saying is that what has been, the concern for this committee at this particular point has been the question of why these documents were not provided. Because if these documents were provided as required, we will not even be having this particular query. And allow me to read Article 197, Chair, of the PFM Act, as far as as far as the offenses of financial misconduct are concerned, so that the governor should know this team that he has moved from one position to the other, they are still very much answerable. If you fail to keep proper records or conceal records or conceals or wrongfully destroy the information that is required to be recorded, there is a punishment under Article 199, penalties, which talks about a person who's found guilty of committing an offense under this act, which no other punishment is given, that person is liable of conviction. So it is good for the governor and his team to know that this matter does not just end at this committee level. As much as we'll recommend prosecution of the personnel, it is the responsibility of you as the CEO under Article 179, Governor. And that's why we kept on emphasizing on your team. Governors, kindly stop seeming to defend your team. Let them bear the responsibility, because they end up having unnecessary burden. Kindly, Chair, through you.
Please, Senators, please.
I'm saying in general.
They want chairing the meeting.
You know,
please.
I'm saying in general.
Can we have, Governor, come back to you. Can we have Senator Eddy, please?
Chair, allow me to speak.
And after Eddy,
before you intervene.
Senator Eddy, please.
Yeah, you know, we are still in the Senate. If somebody has a point of order, they can say point of order.
Point of order.
So we don't shout. So that if something needs to be rectified, it can go ahead. But Chair, my understanding of capital fund maybe is working differently in Meru. But my understanding of capital fund is a fund created to be able to, purchase particular capital or capital goods, if you may, whether it's land, whether it's some equipment, and sometimes even in the line of product, it could be funded as created to buy particular product for production. so that you can be able to deliver. And that fund, the common practice is that for you to replenish that fund, you must be very clear about what that capital good is or what those capital goods are, right? To the extent that any replenishment is denoted by proper accountability on what that product is, has it been valued, is there even a contract that is ongoing, to the extent that the capital fund cannot be just an amorphous fund where money is put waiting for some futuristic understanding. It has to be very specific. Governor, is that my understanding correct?
You're right.
Yeah, so I'm saying this because one of the officers, what's the name of this gentleman? Tamiano. And you're the chief officer. You know, you have said something that now has pricked my conscience. Does this capital fund in Meru County, Embu County, I apologize, Embu County, does it have an act from the county assembly governing it?
Let me state here very clearly, Senator, there is no fund. Absolutely. It is now under FIF, which we have started implementing, that they will have their fund. But in the previous arrangement, any development projects were done with money from the executive. There was no fund set aside in the hospital for those kind of projects, like the senator has alluded. There was never a fund, Senator.
Chair, can you give
that's
me
why I think that's why the chief officer was saying it is now those development projects that are then deemed to be part of. Maybe you should explain better. But there's no fund. There's no fund. Absolutely no fund.
Chair.
Let's start there. There was no fund. Otherwise, I would have been aware of it.
Chair, just allow me 30 seconds.
Honorable members,
Please,
30
Chair,
seconds.
30 seconds.
Because we are doing very badly.
Chair.
We have 3 queries to go.
Chair.
Chair, point of order before the Senator Dama speaks.
No, you
just a point of order.
cannot argue with the chair.
I'm not arguing.
Let Senator Ledama handle the matter. You have already raised your matter.
I'm just saying a point of
Senator
order.
Ledama, proceed.
Chair, you know, Eddie, I would allow Eddie to speak because it's good for us to get the things.
You see the
problem.
problem, members, you must appreciate there is a chair on the seat.
Chair.
And the chair is the one who chooses who to speak.
I accept.
You cannot choose yourself.
Chair, we have a problem here. And my 30 seconds, I want to use it this way. We have a problem here of opening up a can of worms. Mr. Chairman, I've gone through these responses, not only on the first query, the second query, the third query, and the issue raised by the Auditor General is one. No supportive documents have been provided. If we start now opening and interrogating that can of worms, we don't know whether some worms have got 10 fingers, others have got 20. My request, Mr. Chairman, is this. When we read the query, because if you look at what I've done, I have put an X in all the responses the governor is giving. You are responding to what you've not been asked. Let us be specific. If you now open a can of worms, we do not have a way to verify because we are now converting ourselves into auditors when auditors could have been looking at this. So the issue, Mr. Chairman, progress. Read the query. If the supportive document have not been provided, give a way forward. It's not helping us. This is my request. Because already this is an adverse opinion. So being an adverse opinion, it leads a lot to be desired. Already. Just outright there. So we're already limited in terms of our scope of investigation. So let us not try to think utopian in the sense that we can interrogate matters and we do not have the documentation.
Chair.
Senator Miraj and then Modigi.
Chair, you see some of the members came here as we had already started the program. And it's so unfortunate that some here are trying to say that the governor is defending some of her workers. she said here eloquently that most of the accountants and managers of these hospitals were not competent enough, and they have since been transferred. So it is up to us as a committee to give directions on how the former accountants and CEOs of this hospital are to be dealt with. But to assume or say that the governor is defending some of our officers is not correct, because she said very well that some of the managers of these hospitals were not competent enough, and they have since been transferred to other departments.
Chair.
Very well. Let me make directions on this matter.
But Chair, kindly allow me to put the record straight.
Yes.
I don't think while seated here I defended any officer of Embu County government, and for that matter, anyone who served in level 5. They've let us down. We are here because they failed to do a certain job that they should have done, and the law is very clear. But please let me go on record that I haven't defended anybody, Senator.
Let me go on record by withdrawing that. I didn't narrow it to you, because in the beginning.
The cameras are here. They will take it up.
Camera, take it again.
Senator Mutinda, you are out of order.
No,
you are out of order. You are out of order. But, you have to seek the permission of the chair for you
I request to withdraw.
To get an opportunity to speak.
I request to withdraw.
You don't exchange with the witness.
No, we are not exchanging.
When the chair is there.
No.
Please.
Actually, we are helping.
Let's be fair to each other. Be fair to the chair and also be fair to the witnesses, please.
Can I proceed?
No.
Okay.
You are not proceeding.
So, Governor, the chair has not given.
So, honorable members, I think I'm going to direct this. That this query, together with the previous query, the next one we are yet to go there. We resubmit, the county government, you resubmit the response and give us response which is responding to the query and is addressing the issues in the query. And then we will determine as a committee, based on your fresh responses, the actions we are going to take. But I also want to agree with Senator Eddy and Senator Ledama. I think we are going to a point where we will not get ourselves into a situation where we have to reopen the audit. Once the audit report has been published and a certificate has been given, we will restrict ourselves to the audit query. Audit query, because these things we are doing here should have been dealt with at the exit meeting before the report was published. So I think in this case, just resubmit the responses and then the committee will determine the next course of action. So that being the case, let's proceed to the next query, unsupported employee cost. So members, we are trying to manage time because it's already past 1:30 and you are supposed to be in the chamber at 2:30. So we need to help the chair manage time. So unsupported employee cost.
Thank you, Chair. For this particular paragraph, it had two sub-paragraphs. One of the first sub-paragraph, that one has been addressed. The list of all the employees, the staff returns, the monthly returns, the payrolls.
You need to read the query first, Auditor.
Okay, thank you, Chair. The statement of financial performance reflects employee costs amounting to Kenya shillings 545,228,280, as disclosed in Note 16 to the financial statements. However, monthly payrolls in support of the expenditure were not provided. Further review of the casual employee records revealed that 29 casuals were engaged continuously for more than 3 months, in contravention of the Employment Act 2007, with no justification. In addition, contracts for casual workers detailing the terms of engagement and approval from the County Public Service Board to engage the casual workers during the period were not provided. In the circumstances, the accuracy, occurrence, and completeness of the employee cost balance of Kenya shillings 545,228,280 could not be confirmed. Thank you, Chair.
Governor, your response?
At the time of the audit, the payroll for Embu Level 5 Hospital was not attached, though it had been manually split from the county payroll and is hereby attached for audit verification. The casual employees were engaged by the hospital board on a renewable contract in the year 2013. There were no casual workers engaged during the year under review. Refer to Appendix 1B, sample payroll for June 2023.
Auditor, your comments? Auditor, your comments on the management response?
The issue has been partly responded to. The first paragraph, the response has addressed the issue. However,
that is a provision of payroll.
Yes, Chair.
Okay.
That one has been provided. Our main concern was about the casuals, which is thorn in the flesh in all the counties. We find that the casuals in the hospitals, they keep on working continuously. So we need guidance from the committee.
Chair.
Chair, we have since put all our casual employees into the IPPD for a period of 1 year, contract of 1 year. That's what we've done so far. It's a big challenge, but that's what we've done as a county. They have 1 year contract period.
Okay. So can that evidence be produced?
Yes, we can provide that through the payroll. The payroll should be able to provide that, and we already submitted the payroll as attached.
Senator Kisang?
Chair, at least the one on the cash or contract employees under the chair, as I said yesterday when we had the West Pokot, there are policies in place. So basically, as a committee, we should not belabor and take a lot of time on that. In your interim recommendations, you tell them what to do so that, going forward, they don't have to repeat. And at least they already have a solution. 1 year contract, after 1 year, maybe they renew, until at such a time, maybe when they can put them on permanent and pensionable under the chair, so that you can move to the next audit query, because this is basically straightforward. It's on payroll issue.
Sure,
just comment and then we move.
Now, Governor, I still have a serious problem with the way your team reads and understands the Auditor General's query. I've picked up 3 issues. You've attempted to respond to only one. Number 1, there's an issue of documents not being provided, supporting monthly payroll in support of the expenditures were not provided. So the first thing you need to do is to supply that and give an explanation during the audit. That is query number 1. Go to issue number 2. Issue number 2, you had 29 casual workers which you engage continuously for 3 months in violation of the Act. Respond to that. Issue number 3 is that contracts for casual workers detailing the terms of engagement and approval from the Public Service Board to engage casual workers during the period were not provided. So when you come now and say at the time of the audit, the payroll level 5 was not attached, even though it had been manually split from the county payroll, it doesn't help us. Answer each query. Each query. Because the danger of it, Governor, is that you do not answer. Ledamo Lekina, Eddie Okech, Senator, Tabitha Mutinda, my sister Miraj and the chairperson will sit with the secretariat and the auditors during a retreat. And we'll go through each query by one. And we will tick and say, did they provide this? No. We go to the law. What does the law say? Senator Eddie was trying to take you to that direction and tell you this is what should be provided. If it is not provided, there are consequences. So I would really plead, don't be in a rush to open up a can of worms. Read what the auditor is asking. It's very simple English. Because if I ask you right now, with the permission of the chair, why did you engage 29 casual workers for 3 months in violation of the law?
Chair, as you can see, I have stated here that these were casual workers that were engaged since 2013. I couldn't sack them.
Okay. So that's
sack
no,
them.
no, it's okay. You're attempting to answer it, but does that make it
And
right?
during the year
Chair.
in review,
Oh, Governor, wait a
during
minute.
the year in review,
Governor,
Chair,
I'm
we
speaking.
never engaged a casual worker.
Governor, I'm speaking. Whatever you're saying is not going on record. I'm the one on record. Does it mean that because the wrong has been committed for 10 years, you continue committing that wrong? Does that answer the question? It doesn't. What you should be asking is this: how do we fix this thing? Do you then now recommend through the Public Service Board and say, these 29 workers, since they've been here for a very long time, can we give them permanent position? Because it means you need them. Or
Chair.
can we get rid of them?
Chair, you know this matter.
Let the governor
Chair,
respond.
let me state here, some things are easier said than done. I found not 29 casuals in Embu County. I found over 500 workers, casual workers, working in different health facilities in Embu County who are casuals. Now, turning them into PNP would have meant that our wage bill was going to hit even up to 70%. So the most we could have done was ensure they were in the IPPD, which we did, and then give them a 1-year contract, renewable. That was upon advice by our Public Service Board. So when you say, if you need them, employ them, and there's no money, and you can see we're already fighting for more money into the counties, sometimes some of the things that happened before we came have put us in situations where we find ourselves unable to undo, because they have both, sometimes you're sending away people who we need anyway, but then we don't have enough money to pay them.
Chair.
And we have slowly, Chair, we have been engaging even with the union, and we are slowly bringing them in as money becomes available. That's what we are doing, Chair.
Chair, members.
And let me also say this. This issue of casual workers, especially for our health facilities, whether it's from level 2, level 3, level 4, level 5, is eventually going to get sorted through this FIF. And when SHA rolls out and works, that is where we are going to get money to pay these people. For now, the truth of the matter, and I'm not the only governor who is in this situation, we are almost all of us. Me, I have 500, some have 1,000 plus. We are unable to do what you're asking us to do because the money is not available.
Yeah, I think this is, let me just finalize by saying this, because this was my query.
Just a moment.
The problem with the governor, chairman, is one.
Senator Lekina.
We are not dealing with the other issues outside. We are only dealing with the 29. We're not dealing with the 500. It is just a matter of the 29. It is a matter of supporting documentation. Is that asking for too much if the auditor say, provide us this documentation?
That I am agreeing.
Then focus on that. Don't take us into circles.
But
it is annoying, Governor.
You're the one who has asked me to employ them.
It is annoying.
Members.
It is annoying when you move away from the issue we are discussing. We are trying to assist you. I'm trying to assist you here. In fact, if you listen to my submission, I am actually trying to help you. My only concern is this. Your people who are giving you these documents to come and read here are not answering the questions. Just say, give us that explanation you're giving us. Tell us, these 29, I found them working there. Don't tell me I found 500. Because then now it will force me to tell the auditor, why didn't you not do your work to say that it is 500? You only did for 29. I'm assisting you here and you're not seeing.
Point of order, Chair.
Chair, point of order.
Point of order.
Senators,
Chair,
let me.
Chair, I can only answer that which have been asked. He asked me, can you employ them permanent? I said I can't because it's not just 29 I'm dealing with.
Correct.
I'm dealing with over 500 casual staff in different health facilities. I don't know why that
Honorable members,
well.
Honorable members, I want to direct this, please. You know, even when we are in this committee, we need to adhere to the standing orders, and we need to maintain good conduct in this deliberation. Because as a chair, I have the powers to throw you out if you are not complying with the the standing orders. So members, please let us maintain decorum. You have a right to ask Governor any question, but you must do that within the requirements of the standing orders. Senator Kisab.
You know, Chair, I don't know why we are really taking a lot of time. This is the same issue that we had yesterday. And these are our people on the ground. What we advised the governor for West Pokot yesterday, that if you still want to maintain these people as casuals, let them work, let them, you remove them for a week, and you let them come back. And the governor has said she has even put them on contract for a year. So, and I had said, as the chair of the committee, Senator Osotsi, is what we need to do is just to give the governor a recommendation. Otherwise, we are making a mountain out of a simple HR policy.
Yeah, so just like yesterday, we give an interim recommendation, but also members, we must note the issue of casual workers for hospitals is just for all county hospitals, and is a matter that maybe in our report, our main report, we must deal with. Yeah. Because we know the kind of games that go on in those hospitals, especially with hospital managers. How they employ people who some of them are related. I'm not saying this is for Embu, but we know what happens in other hospitals. We had other counties here, and we know what happens with those casual workers. So, Governor, you have given us an undertaking that you are doing something about it, but we will still give you an interim recommendation on the way forward. Senator Edi.
Chair, these are just two comments for the purpose that my understanding of this committee is not to be adversarial to county governments. Is to help county governments perform. Yes. And number two is also to help you pick areas where there could be danger in laws that then might affect you. I have seen even in Senate where some of our employees, you differ with them, they go to court over an anomaly that you did previously, and then they wreck a lot of money out of you. This, my friend here, Senator, has got a serious case, I can tell you, and that I'm helping with, of a former employee that he did away with, and because of Employment Act 207, they're giving him trouble. The auditor is telling you that the 29 casual workers that you have here, they are continually working up and above 3 months that they're required to work, and it's illegal. Illegality, we can't moderate. Unfortunately, they say that the law is an ass. That's what they say, right? On the matter of illegality, Governor, I wish that you could see partnership in us, that just regularize. This is an issue of regularizing that illegality. Because if you don't, you can go and scream about 500 workers as much as you want, but one day one of those casual workers will go to court and you won't believe it. The demands that they will make, that they are not in PNP and they were engaged for more than 3 months, they work continuously, they are demanding, it will be more expensive for you as a governor to deal with than what the auditors are questioning you right now. Last thing, Chair, it's my humble view and my humble submission that in this committee, I would rather deal with one audit query exhaustively than rush in all audit queries and scan through them without solving them. We are not helping these governors if you go that direction. We cannot keep on using this idea that we don't have time. Members, shut up. We don't have time. Let's continue. I cannot continue in instances where a capital fund has been created of over 1 billion that I cannot be able to validate and be able to have documents on, and then I say, let's continue. I'll be injuring the governor. Yes. Next day she'll be summoned by EACC, and before I realize, my governor, who is one of my favorite governors in the country, I mean, Chair, we cannot do that. We must exhaust a query. We deal with one. If that is what the time has given us, so be it. We'll consider other written submissions on the others.
What you are addressing now is an internal issue, but you also need to maintain punctuality. You don't come in the middle of a meeting and restart all over again. And then you want the chair, to be lenient on that.
There's no
so, honorable members, let's proceed. Let's proceed to the next query. The next query is on UHC. This query, we looked at it yesterday and we said we will need the input of the ministry because the requirements under the Kenya quality model for health policy is an issue we need to interrogate with the ministry. So we will now proceed to query number 3 under basis of conclusion, the expiry of medical supplies. Auditor.
Thank you, Chair. Expiry of medical supplies. The statement of financial position reflects an inventory balance of Kenya shillings 45,598,538, as disclosed in Note 30 to the financial statements. Review of the store records on pharmaceuticals and non-pharmaceuticals revealed that 343 units of various drugs worth Kenya shillings 7,981,077 had expired as of 30th June 2023. In the circumstances, the effectiveness of internal controls on management of pharmaceuticals and non-pharmaceuticals could not be confirmed. Thank you, Chair.
Governor, your management response.
Thank you, Chair. Chair, let me begin by saying this, and this is for the record because I don't want the wrong information to go out there. These drugs expired before I came into office. There's no single drug in Embu that expired after I came to office. I went to the stores, I found them there, I questioned about them, and I was told very many things. But let me read the management response. I needed to do this because I know it caused a lot of problems for me on the ground, and it is important I be very, very clear. These drugs expired before I came, and therefore, let me read the management response.
Proceed.
The expired drugs were mostly donations from our development partners dating as far back as financial year 2017-2018. The expiry of the drugs was caused by a myriad of challenges. These include short expiry dates of donated drugs, COVID-19 epidemic in the year 2019-2020, which led to low numbers of patients at the hospital, industrial action by healthcare workers over the years, reducing the number of patients, specialized care medicine or change of patients' medications by doctors may minimize the usage of certain medicine. The expired drugs were disposed, and this was done about 2 months ago. Was it 2 months ago, CEO? Yes. About 2 months ago, the expired drugs were disposed in line with Section 165(1)(e) of the Public Procurement and Asset Disposal Act 2015. And we have Appendix 3 that has a list of all the expired drugs that we disposed of as per the Asset Procurement, Public Procurement and Asset Disposal Act 2015.
Auditor, what's your comment on the response?
Thank you, Chair. We leave the guidance of the committee on this issue.
Okay.
Chair.
Let's start with Senator Mutinda.
Thank you. I'm just concerned, Governor. I'm just concerned that you say these drugs had expired even before you came to office. You came to office in 2022.
Yes.
So these drugs have been within the hospital stocks from financial year 17, 18, 18, 19, 19, 20, 20, 21, 4 financial years just in place for you to just come and dispose them last year?
This is what happened. First of all, let me shock you. Yes. In one of the hospitals where I went immediately, I was made governor. That is Ishara level 4. I found a store full of expired drugs. Some expired in the late 90s. Believe it or not. Late 90s. And when I asked why they have never disposed them off, they said it's because there's a whole process of disposing them off. Even the trucks to carry must have NEMA certification. Just that simple process of putting together the teams to help in the disposal is what never happened. What I would like to say is that they were all in a separate store, and they were not just in level 5, there were some in level 4 hospitals, and we mopped up all that together with the support of NEMA, and we disposed them off and destroyed them all in our incinerator at the hospital level 5, because that's where we have the biggest. So yes, they took that law.
Chair, just a query.
Yeah, Senator Modigi.
Asante, Chairperson. Si atina supporting governor, vile ilifanyika kutoka 2013 to 2022, juu ya zile ndawa zilikuwa zimeharibika, zote zilikuwa zimewekwa store. Hakuna ile uongozi wa zamani ulikuwa nataka kuhusikana na hizi vitu. Lakini wakati kulikuwa na sinda ya CEC ambaye wa zamani wakati aliondoka, kukakuja governor akalete CEC mwingine, baadaye ndio walikuja kuona hii shinda yote itakaa katika hospitali. Na ndio hapo CEC na gavana walikaa chini na wakaandika barua, ndio wakakuja wakaangalia hizo dawa na zikawa dawa zinafaa sitemwe ama siwe kwa moto. Hiyo ndio shinda ile ilifanyika. Hakuna mtu alikuwa ataka, wale wa zamani angetaka kuhusikana hizo vitu. Kwa hiyo mambo ya dawa, mimi najua gavana amejaribu, kwa sababu wakati ameingia amejaribu sana Embu County wagonjwa waweze kupata dawa, hapo ndio shinda ilitokea. Kwa hivyo mimi naunga mkono vile gavana naongea, ingawa ni kitu iko na huzuni mambo ya dawa, lakini anaongea ukweli. Kwa sababu CEC amekuja amejaribu sana kupandilisha mambo ambayo iko Embu County.
Chair.
Senator Ladama.
Thank you. Governor, I want us to look at your responses. And then auditors, I'm concerned about one statement that you made. You leave it to the committee to be able to deal with it. So, Governor, your response states as follows. The expired drugs were mostly donations from our developing partners. Can you tell us from which year? Because it said here, dating as back as the year 2017, 2018. So can you give us a breakdown and say, for the drugs that were donated to us in 2017, 2018, this is the value of the drugs that expired on that particular year. Then we go to the next year and the next year. Now, if we go to your first response on your query, you said short expiry date of donated drugs. So the question that I have there is that if there is a short expiry date, why do you think that they received them? Do you just accept everything you are given for free? It's okay, you'll answer my question.
Senate, I can't answer that because I wasn't there.
Then don't write that.
I mean, we have to write what was the case then, because we must state the facts.
No, this is not a fact.
But
this is, Governor, this is not a fact. Allow me to answer my question. You can answer. The issue here, I'm trying to assist you so that we find a way. I'm not actually trying to fight with you. I'm trying to assist you so that we can be able to find a way to deal with this matter. And also advise you further that anytime you get any donation, don't take them if they have a short expiry date. Number two, you've also indicated here industrial action of health workers, specialized care medical patients. This, according to me, does not answer this question. I would request you do the following. You provide us a breakdown of the drugs from 2017-2018 that expired. Subsequently, in regards to the query asked by my colleague, Senator Mutinda, each year, these are the drugs. In your response to Senator Mutinda, you indicated that it is not only in one hospital, it is in several hospitals. But here, according to what the auditors have said, they said review of the store records on pharmaceuticals and non-pharmaceuticals. So it begs the question, did you review all those stores in all the hospitals, or did you only review one? Because the problem could be wider, in the sense that you will need to do more work to be able to go out and fish out all the drugs which have expired, and then you dispose them. So if you can have your team go through and say this is the record that they received for 2017, 2018, all the way to 2023, and the drugs that expired in each year, so that we can clear this query. When you come here, we are here to mitigate on matters. We are here to assist you resolve these matters. Otherwise, the next recommendation that I would have had is to tell the chair, as a committee, let us adopt the Auditor General report as is. And then we give recommendation for prosecution, for investigation. Where there is anybody, they are prosecuted. So when we try to mitigate on matters, I think it will do you well if you listen to the line of question that we are asking to see how we can support you on that matter, or how we are going to be able to write our recommendations.
Senator Miraj, then followed by Senator Edie.
Thank you, Chair. Mine is an observation. Ever since our committee started auditing the hospitals, we've seen that there are so many medicines that are expiring. And when we go to the hospitals, the citizens are talking about not being able to access medicine and being given recommendations to go to chemists to buy. So I feel it is the right time we talk about the disposal issues that have risen up in this sitting. Because previously, we had the same issue of expired medicine. I think we need to delve into it much more.
I think you are right. This problem is across all the county hospitals. And maybe auditors, you will need to investigate further why this particular issue is happening in all the hospitals. Senator Edie.
Chair, I'm seeing maybe because of low sugars, emotions are rising high. But I think that we need to ask ourselves what is the essence of this query, Governor. The essence of this query is to make sure that, one, there is value for money. It's a very big question that we deal with. Whoever was in the office that time, if we cannot hold the governor currently accountable to this, they must be held to account. Because there's a lot of potential fraud in this kind of expiry of drugs. There is possibility, and I'm talking theoretically here, that somebody could have just chosen not to give patients drugs that were there at that time and maybe gave their own drugs. This is one possible theory. So in this kind of query, if I don't have record of the drugs in question, when they were received, which ones expired when, vis-a-vis the number of patients that came within that period, then we cannot be able to deal with it. Then it leaves a lot, and this is where EACC comes in place, and then it becomes very, very, very messy for governors, because 7 million is not pocket change in a county like yours, where you're dealing with casual workers, 29 of them that don't have employment yet. 9 million is a lot of money. In fact, it's 8 million because it's 7.9 million. So that's 8 million for me. So I think that the comprehensiveness that I would wish to see, that the vigor, is which drugs are we talking about? Is there a list of all these drugs?
It is here.
Yes,
Senator,
yes.
The list is here on Annex 3.
No, I'm not talking about your response now. I'm talking about what should have been availed to the auditors, so they can be able to detect the value for money. Then when the issue of the drugs came about, your officer should have given the auditors, because if you give them to me now, I'm going to be auditing, and that's the work I don't want to do, that I've been complaining about the entire day, right? So we are giving each other feedback here.
Yes,
and
sure.
I'm mostly giving your accounting officers feedback. And I hope that the CEC Finance is also taking note, because under Section 104, you have got the full responsibility for management and managing this accounting process. So the accounting officers delve into audit queries at the time that auditors come. Show them all these drugs that came about. If the list of the 45 million, the list of drugs that cost 45 million, up to about, let's say, 35 million were good, right? Let that be clear, and then this other query about 8 million, take them through. These were the drugs. These are the ones that were received. You see, like the answer that the governor has given here, very nice answer, short expiry date of donated drugs. To what value? Which drugs were those? Is there a catalog that is showing these particular drugs were worth 2 million, but they had short expiry date? Then this won't be an audit query, because the auditor will say, fine, I went through those worth 2 million, and they had this expiry date. And then there is specialized care medicine. Worth how much? Were they 3 million? Were they 2 million? And those ones were not used during period between 2017 and 2018. You see, it makes it neater and not put governor in a back and forth situation. That's the comment I wanted to make. The depth of that engagement with the auditors is lacking where there is an issue that could denote value for money. Yeah.
Thank you.
Chair, maybe before the governor answers, Chair.
You the chance.
No, I'm just saying.
Governor, you come in at the end. So let's have Kisang, and then I will ask a question. Then, Governor, you will combine all that.
Chair.
Senator Kisang.
Chair, I agree with what my colleagues have said, especially what just Eddie has said, to analyze these things. Secondly, Chair, yesterday we said we need the Minister of Health, we need KEMSA and Council of Governors to come before this committee. I want to propose, Chair, that this is one of the things that we need also to discuss when we are in that meeting, because when you say short expiry date of donations, you know, it could also be an issue. Some of the pharmaceutical firms or even KEMSA, when they see some drugs are nearing expiry, they need to push them somewhere so that it's not their business to do disposal. So it's also good to note that, so that also we caution the Council of Governors before accepting any donations, verify, do you need them?
Yeah.
Because you might not need them, because somebody is trying to push it to you. And then also, another issue, because we know in our public hospitals, in our all county hospitals, they are always short of drugs. When you go to E10, County River Hospital in Elgeyo County, patients are given prescriptions and there are pharmacies across the hospital to go and buy from them. So how can we have expired drugs when there are shortage of meds in the hospital? So mine is just to be cautious so that they don't give you that business of going to dispose, because they are seeing push to them.
Very well. I think you brought in an important point. We will list that as one of the issues to engage in the joint meeting. Governor,
yes,
Mark, you want, I'm really time.
Just a comment, Chair, on the query. And the query was that in the circumstances, the effectiveness of internal controls or management of pharmaceuticals and pharmaceuticals could not be confirmed. So maybe as the governor responds, maybe she might give an idea on how they have now improved these internal controls so that then we don't have this expiry of drugs going forward.
Yeah, exactly. The internal control, Governor, before you come in, internal controls, listen to me. Internal controls, one issue that has appeared in all the audit report, this one, I think it is not included, is on automation. So what is the extent of automation of this hospital? Do you have a system that tracks, for example, pharmaceuticals, so that you are able to track the expiry date and the stores? What is in the stores, what comes in the stores, what goes out of stores?
Chair, we have a system, but it's not adequate. In fact, we are just at the transition from an old system to a new one that is more effective. We are able to know how much stocks have come to the central stores, how much of those have gone to different facilities, the expiry dates. We are able to monitor with the new system what is going out on a daily basis, patient by patient, and that will help us actually take care of something that Senator has mentioned here. We have situations, and that is a challenge we are having across the county. You will find that some of the medical workers in the hospitals are the same ones who own pharmacies outside of the hospital. So you will find that they have refused to prescribe what is in the main hospital. Instead, they send the person out to go and buy. And that is one of the biggest challenges we are having. And the same applies to issues like laboratories, issues like x-rays, because there are so many, there's a lot of conflict of interest from within the establishment. And that's why we feel this system will really help us, because then we are able to tell, why was this patient asked to go for drugs outside the hospital? Were they not in the system? Were they not in the stores? And that way, we can deal with people on a case-by-case basis. That's why we are bringing in the new system. I will allow our MedSoup to mention other internal control mechanisms that we've come up with. But let me say this, Chair. It is clear some of the issues I am having to come and answer here would have been answered if records and information was provided, as has been mentioned by the senators earlier. And I'm in total agreement with them that the problem is the people who are responsible in providing this information never did. And therefore, you come here and I have a list of expired drugs, Chair, the quantity, expiry date, unit cost, value, which is now coming before the committee, but should have gone to the auditor in the first place. If this information had been given to the auditor, we would not be here discussing this particular issue. So I want to promise you, Chair, today is the first time we've come on this matter of level 5 hospital, and it takes care, it was at a transition where we were moving from the former regime into my regime, and so a lot of things didn't work out. But I'm promising you going forward, and especially now that the entire team is here from level 5 and the health department, we are going to make sure that the next time we come before you, you're not going to see these kind of things coming up again. We are going to resolve them. We are going to make sure information is given in a timely way. We respond adequately on the management letters, and only that which we are unable to respond to will find its way here. And I'll take up leadership on that, Chair, because this surely should not be happening.
Very well. You see, also, senators, we have senators not been looking at the audit report for hospitals. Maybe if we did earlier on, we would have discovered these issues. But now that we are looking at it, we expect that in the next financial year's report, some of these issues will be resolved, and we'll have proper management of these hospitals.
Thank you, Chair. Chair, there's the MedSoup also wanted to just talk about the internal control mechanisms, Chair.
Well, we are constrained of time. We are supposed to be in the chamber.
Okay.
And members also, maybe they need some 2 minutes of a bite before they go to the chamber. So I think we'll close at this point. The meeting is therefore adjourned until on notice. No time. We have